these are the ones you remember. So, and it brought you back here, which I'm sure wherever your parents are, they're looking down thinking, wow, this is really cool, you know. It worked out. We left some, but it created some sort of connection, or recreated a connection, or something they were grateful for. So we're now grateful. So
thank you.
And maybe do they know how you choose the?
No. No, so, I mean, the immediate family knows. I mean, my sister knows and Daniel, but the greater group here doesn't know any of the story, so I'm going to give the whole story.
Okay.
Yeah. So they don't know why we
chose that. So we'll show them.
Yeah, exactly.
So just before the second part of the group arrived, we were talking about the hospital and how our Director General has been here for 30 years, and he's only the 4th Director General in over 100 years, over 116 years. So it just shows that...
Jonathan Levy.
Jonathan Levy.
He was our doctor in Paration.
Ah, okay.
When he was still in the army.
Yeah. So he's a very well-known and reputable man. You were asking me what he was doing before. He's a specialist in gastroenterologist, and he still has a clinic once a week where he sees patients. So it's very important to stay connected to their field. The one before was, trying to think, was also a doctor. The one before that, yeah, they were all doctors. They were all doctors, so that's, but at some point you have to sort of look for a balance. You sort of lose touch with the medical hands-on with patients work, and you have to be more of a managerial position. But because he's a physician, he really connects very well with the doctors, knows their needs, knows how the hospital has to grow, and to be honest, I think that he's a visionary. The man, what he's done with this little local hospital, to put it on the map like that, is incredible. It's grown, I mean, it's growing to every direction. We are now also fulfilling a very important core message, was to be a light amongst the nations, of Lagoim. And he's done that, he's achieved that. From here we have so many centers of excellencies. People look at some of the professionals we have to learn from, to even just the NICU. Last time you were here, I don't think we had it yet, the first MRI for babies under 2 kilos.
Oh, wow.
So this is the only one in the world. There's no other place in the world that has it. The reason why we have it is because it's an Israeli invention. A company in Israel developed it, and they looked for the place that had the highest amount of babies that needed this equipment. And with our 22,000 babies, obviously, you have a large amount of babies that end up into the neonatal intensive care unit. So the MRI is a life-saving thing. You're able to check issues in the brain, which you wouldn't be able to find out for a few years. So it's incredible. It's like, and that is pure light among the nations. This is really from Yerushalayim, coming, sharing information on how to have better medicine and how to help from the beginning. So, and you can name it. Every department has something extraordinary. We have top leading doctors in Crohn's disease, pediatrics Crohn's, who are doing humongous research and are internationally renowned for their work, and people look at them and consult them how and what, and etc. Breast cancer, BRCA gene. Again, we have one of the leading geneticists in this hospital.
Audrey, tell them the iPad story.
The iPad story?
I think it's an amazing story.
It's, on the one hand, we're very proud because we're very upfront with, you know, startup nation and technology, and we have the newest, coolest machines and robots, etc. But then on the other hand, we also have a very humane approach to things. We're known, we used to be known for the hospital with the heart. and it really applies today as well. We still, we have people who look at the patients, their needs, their emotional needs, rather than just their physical needs. I mean, yes, we're a hospital, you assume you get the best medical care, right? It's a given. But then you also think of how can you fix little things that make a huge difference. So when we opened, when we were about to open the children's hospital, we had children's departments, but what we decided to do is to build a new building, which is where the NICU is, and that whole building is called the Next Generation Building. It's got everything to do with the future, starting with gynecology, maternity, NICU, children's hospital, and that's really the whole package. And when it came to open the children's hospital, the director of the children's hospital is called Professor Schlesinger. He's actually the grandson of the second director general of the hospital. And he said to Professor Alevi, it's all very nice, but I'm not opening this hospital unless every single position where we treat a child has an iPad, like an interactive tablet. And Professor Alevi said, you're crazy? Well, am I going to go and tell my donors, I'm sorry, we don't want a pump or a respirator, we'd rather have an iPad for every kid. So he said, listen, it's very simple. Unless I have an iPad, it's not really an iPad, it's more interactive than that. Unless we have one of those touch screens on at every bed, even outpatient treatment, I'm not opening, it's very simple. So he said, okay, they started the struggle, and he said, okay, fine, you win, what can I do? So he got him the iPad, and then he said to him, why is it so important? What can I, then give me something to tell my donors, I have to convince them. So he said, look, you have to realize that the pain of jealousy is so much more painful than the physical pain they might be in. You have here a very wide spectrum of children that come through. You have rich kids from well-off families that come with an iPad and an iPhone and whatever, everything electronic. And then you have either a Haredi kid that comes along where they don't have it because they don't want to have it, or you have an Arab child that comes from a village and they don't have it because they can't afford it. And then you have all these kids sitting, you know, either sharing a room or receiving treatment as an outpatient care, and they're looking at each other, staring at each other, and that jealousy is so much more painful than their broken arm, or that their allergy, or that their whatever it is they're coming for. So he said, I want to make sure that when my children receive treatment, they receive same treatment, including high tech or anything else. And that's what that's the pitch he gave Professor Alevi.
It's an amazing story.
But then it went a step further, because the nurses came and said, it's incredible. We're going to the rooms to take blood or whatever, and the kids are no longer hysterical. They're not crying, there's no crying, there's no screaming, the mothers are calmer.
They barely look up, probably.
They're like, you can do anything you need to
Focus
do.
on the screen.
It's very
Focus on the screen.
and they can work faster. So Professor Alevi said, oh, that's great. Time is money, they work faster, that's great. So it was another good argument. But the truth is, it's incredible, because you don't always get an appointment to come to hospital. Sometimes you arrive to hospital because something happened and you didn't prepare the bag, and you don't have everything you need for your child that has different needs, you know, the nappies and the food and the change of clothes, and then the high tech and everything. So you arrive here and you need it. You need whatever you can to keep them busy, and it's all here. You can just walk in and you have everything you need. So that's really.
So Audrey, I think maybe since we're all here together, maybe I'll give the background story now. So everybody, and then we go up, and then look, and then come down and have refreshments. So first of all, I mean, I'm so happy and thrilled and honored that you've all come here today, and I'll talk about the linkage and the stories that we all have together in a few minutes. But like, why are we here? I mean, how did we end up coming in this room to do a dedication at the neonatal intensive care unit at Shaare Zedek Hospital. So it started sort of serendipitously. I mean, you know the story of my parents, and my mother passed away in 2008. My father passed away in 2017. And I found a small little note that was written that said, in addition to, you know, everybody has a will, they wanted to have a donation to Shaare Zedek Hospital given by my parents in honor of both sets of grandparents. So my mother's parents and my father's parents. And for Iris and I, this was a big surprise because my parents had very strong connections to this land, having married here, lived here, my sister born here, the close connections with your family, which we'll get to in a minute. And my parents had been always very open to myself and to Iris and to the other grandchildren. We knew about their connections that they had with other institutions in Israel. We never, ever once heard them mention Shaare Zedek Hospital, ever. So now you start to try to unravel the mystery. So I first made a phone call to the head of gifts for Shaare Zedek, Friends of Shaare Zedek in Los Angeles. His name is Paul Jezer. And I told him, I said, Paul, you probably don't get calls like this every day, but here I'm a total stranger to you, and we're about to give you a gift to this medical center, and I have no relationship to you. He says, do you ever get calls like this? He says, not often. But he says, we welcome them. So I said, Paul, maybe you could do some research and try to find out what the connection was of our family to this institution. Were any of my grandparents treated here? He went back as far as he could in the medical records and really found no evidence, but it didn't go back as far as was necessary because not everything is microfilmed over such a period of time. So, long story short is, our best guess in terms of the relationship that our family had with Shaare Zedek Hospital was that my father's father, Grandpa Hirsch, who came back to live in Israel after moving to Canada for a while and passed away in 1963, had a heart condition. And we're guessing that perhaps he received medical care here in Shaare Zedek. He lived in Petah Tikva. Our understanding was back in those times there wasn't much of a cardiology department in Tel Aviv at the time. So that's, beyond that, we don't really know. So let's set that story aside for a second. Now, it is our task to go to Shaare Zedek and figure out what to do. So last summer, almost exactly a year ago, Ron and I, literally I think almost maybe to the date, a year ago, we come here to this office, we sit over here, and we have this introduction with Audrey. And we tell her that background story, and Audrey tells us a little bit about the hospital, and she asks us, she says, is there any specific item or unit that you would like to see the funds dedicated to? And I said, no, not really. You know, Ron and I are both physicians, but this has nothing to do with us. This has really to do with my parents and my grandparents. And so tell us what the needs of the institution are. And Audrey started talking, and she mentioned about Crohn's disease and a gastroenterology unit, and, you know, it's all interesting. And then Rona just said, she said, well, what about your needs in the pediatric, in the NICU, the NICU? And I think that, you know, tapping her on the shoulder was our new grounding in this country, which is our son Daniel and his wife Abby and our beautiful granddaughter Sadia. So once you have a little child here, it touches the heart in terms of the neonatal intensive care unit. And in addition, I think, as pretty much everybody in this room knows, there had been a difficult pregnancy before Sadia. So something touched Rona to sort of bring that up. And Audrey said, well, actually, we do have some needs there, and we'll go up and have a look. But before we went up, and I wanted Audrey to get a sense of our parents. You know, like who were they? What was their connection to this land besides just living here? And what was their relationship to the Jewish people? And something touched me on the shoulder, and this is the story that I ended up telling them. I said, to get a sense of my mother's connection with the Jewish people, I'm taking you to my daughter Miriam's bat mitzvah. And at my daughter Miriam's bat mitzvah,
Ray's mother made a speech. And he'll tell you what she said to Miriam.
so she told Miriam, come sit. She told Miriam, my charge to you is the following. It's from Isaiah. This is what you need to know as a Jew. Jerusalem is the core. The Jewish people have had a longing for this place for 2,000 years. Your mission as a Jew is to remember that, and the sense of her wanting to charge her with that memory was to take those words of Isaiah. If I forget thee, O Jerusalem, may my right hand wither. So I told that story to Audrey. And off we go up to the neonatal intensive care unit, and Audrey was going to show us some things. And before we went up, she mentioned that there is a need for incubators for little babies, and that they have these new incubators, which are called giraffe incubators. And Audrey can describe them better than I can, but in a sense what they are is they allow the baby to stay in a protected, hermetically sealed environment without ever having to take the baby out of it and expose them to the ambient air and possible exposure to any kind of viruses or germs. And it has this long neck so that whatever procedure the medical staff is doing, that the incubator can be put up or put down, and it's called the giraffe incubator. And she said, and we have needs for that, and this might be something to consider. So off we went, and we kind of gowned up and looked inside. And then Audrey said, well, let me show you something else, some other things. So, and you'll visually see this in a few minutes. As we're up there, gowned, and we're looking, and if the incubator is over here, all of a sudden, on my eye, I see something on the wall. Like, it's not a painting, it's it's a metal plaque. A metal plaque on the wall. And I look to the side, and I'm taken aback. Because the plaque says, Im teshkacheach Yerushalayim tishkach yemini. And then the exact words that my mother told Miriam, the exact words that I chose to tell Audrey. And then Audrey tells me that in public spaces in the hospital, you've seen how big this medical center is? It's the only place in the hospital that those words are indicated. Right there in the NICU where the giraffe incubators are. Audrey says, there and in the director's office. So it's not as if everywhere you walk in this hospital you see those words. So, another tap on the shoulder. My mother told us, she told me where to donate these funds. The world works in all kinds of mysterious ways.
Even more, that the amount that you mentioned was the exact same amount.
Yes.
That two incubators.
The two incubators, exactly.
So it's
It was really quite a remarkable moment, and sometimes the divine touches you, and in my view, that's the divine touching me and all of us here. And I just want to say something else in terms of, before we go up and look at it, is that, you know, our tradition talks about kaved et avicha ve'emecha, to honor your mother and father, and so that your lives will be long. And so there's the general sense of that is, I mean, one could say, well, if I honor my parents and whatever I'm supposed to do, take care of them, etc., that your lives will be long. But I think it's deeper than that. And I think all of us here today is the connection to that. First of all, I think what they have done is an indication that you can honor your parents even when you're no longer physically here. Because my parents wanting to donate this to this institution and for this cause is honoring their parents, our grandparents. And they've done that even though they're not here. And they've done that in a way that touches everybody in this room. And it honors everybody in this room as well. So the connection, and Audrey, for Mickey and Carol and Emmanuel. Carol and Emmanuel are husband and wife. Mickey is the brother. Cousin. My parents' connection with this family goes back, if we look at Sadia now, I'm counting 5 generations. So your grandparents and my grandfather, Grandpa Hirsch, had a relationship back in the 1930s when our families first came here to Israel. Then my father and their parents were in business together here in Tel Aviv. But the connection was more than just business connection, and as Iris can elaborate later, the connection was family. My father was an only child, and my father's relationship with Emmanuel's father, who sadly just passed away, you're past the Shloshim, right, was so close and so brother-like. And the same thing for Mickey's father, Yoshu. It was an amazing, beautiful, close relationship. You don't see that in friends very often. And so these also become the extended family as well. And to have Daniel and Abby and little Sadia here, my parents would be beyond overjoyed.
Sure.
I just can't describe the joy that they would feel, knowing that we're here and that what they've dedicated this to is for children, for the development of the future of this country and the Jewish people, and really for all humanity, as you say. It's not just for Jewish children here. And my thanks go out so much to Yaakov and Roseanne, Rona's cousins, because you have become my family as well. You settled here in the Gush Etzion area in Kfar Etzion, and you've also internalized this Imeshkache Yerushalayim. You're grounded to this land. You're with the people, and my parents would be honored to know that you have honored them, and you honor me and Iris by coming here today. I'm so grateful for that. So I don't think I left anything out.
Except for the pause.
Thank you.
So I guess what we're going to do is.
So what we're going to do now is we're going to go up to see the plaque, to unveil the plaque.
Yeah.
Then I'm going to take you into the NICU. We're going to do it in 2 groups because we have too many people to go just in one go.
Yeah.
And then if you want to continue visiting more, or whoever wants to see more things, my colleague will take you to see maybe the children's hospital if you want to see it, if you want to show it, or whatever you want to be doing. I
Okay.
have to go to a next meeting,
Yeah.
unfortunately, but she's very happy to keep continuing.
Okay, but we can come back here and then.
The problem is I'm not sure we have the room.
Ah, okay.
So, but we'll find you a space if you want to.
Yeah, so maybe, because I think, you know, we're a pretty big group, so maybe we'll go up. I don't know that we need to tour the hospital. I think we probably want to just be together. Yeah, I think we just like to be together and talk.
We have Aroma that just opened in the hospital. Aroma, like
oh, okay.
So you can sit there, enjoy, and you know, or whatever you want.
Okay.
I can give you other ideas of where to go. There's
Okay.
otherwise there are few lobbies. You'll see where we're going now,
Okay.
where you'll be waiting in between. It's also a nice, comfortable lobby. There's a lot of space you can run around.
Okay.
So
should we have maybe some
Let's have
snacks
something to
before?
drink
So maybe have some drinks and
So
some snacks
have
before we go
something
up.
to- yes.
Yeah. When do we need to leave this room?
we need to leave this room
In 8
in about
minutes.
10, 15 minutes.
Okay, so perfect. So
10
let's
minutes.
spend 10, 15 minutes here and then we'll go up. Okay.